Welcome back to this next video in which we are discussing stasis dermatitis. So in the previous video we were going over the different causes for edema, and we'd already been through congestive heart failure, chronic venous insufficiency and lymphatic insufficiency. The final one which I would like to add on to that list is obesity. Now, obesity causes a mixed problem with the veins and the lymphatic vessels. It is thought that the excess fat tissue presses on the veins and presses on the lymphatic vessels and therefore narrows them, reducing the flow of fluid out of the legs and therefore leaving fluid in the tissue space to accumulate, and therefore you end up with leg edema. And indeed, edema is very common in people with severe obesity. Pretty much if you are obese enough, you will end up with swollen legs and you will end up with the complications from having swollen legs, one of which is stasis dermatitis. So there we go, there are 4 of the main causes then for edema. There are others, but they are much rarer and they're beyond the scope of this video. So in nearly everyone who has edema, and indeed edema is very common, in nearly everyone who does have it, one of these 4 causes will be attributable. So, let's now talk then about stasis dermatitis, which is a skin condition that occurs because of edema. It occurs on top of the areas affected by edema. And indeed, this is the reason that stasis dermatitis is called stasis dermatitis. Dermatitis, we've discussed, means inflammation of the skin. Stasis is referring to the fact that it is occurring because of fluid stasis. It's occurring because of the fluid that has accumulated in this area. The fluid that is supposed to be moving but which is not moving instead is static. So that's the reasoning behind this name, stasis dermatitis or stasis eczema. The reasoning behind the name venous dermatitis or venous eczema is because venous insufficiency is one of the big causes for this type of eczema. So that's why this other name exists. But obviously, these other causes, so heart failure isn't a problem with the veins, but it's the same skin problem that you're getting on top of the edema, and that's why stasis dermatitis is actually a better name than venous eczema. If they truly do have chronic venous insufficiency and then they have stasis dermatitis on top of these swollen legs, then it would be appropriate certainly to use the name venous eczema or venous dermatitis. But this one, if you like, is broader and doesn't imply that the edema is caused by venous insufficiency. So let's categorically say it then. What is stasis dermatitis? So, in people who have edema from one of these 4 causes, or indeed from a cause that is not listed here, from one of the causes that is beyond the scope of this video, in people who have edema, unfortunately you get a type of skin condition on top, or you commonly get a type of skin condition on top of the area affected by the edema. The skin is not healthy, and you get this eczema on top that is called stasis eczema. So this is what it looks like, and indeed, I wish I did have a picture, but never mind, I don't want to get done for copyright. So here we go, it's commonly this sort of area, and this skin is all going to become inflamed and red and potentially dry and desquamating. So this here, this is representing stasis dermatitis, and commonly edema will be bilateral. Certainly in heart failure, venous insufficiency and obesity it will be bilateral. As we said with lymphedema, it might be the case that it's unilateral in that case, but certainly in these 3 it's going to be bilateral, and you're therefore going to get stasis dermatitis also bilaterally. Now, my understanding of the pathophysiology is not particularly deep for stasis dermatitis. In fact, really, my understanding of the pathophysiology is pretty much an arrow going from edema to stasis dermatitis. So that's pretty much the extent of my understanding of the pathophysiology. If you have edema, you will get stasis dermatitis. I think that the reason that the skin becomes diseased is that the fluid that is accumulating in the tissue space prevents proper flow of nutrients to the skin. If you can imagine all of that fluid accumulating in, let's say, the subcutaneous fat and in the dermis of the skin, then it's going to mean that there's a bigger space between the blood vessels and the actual cells that need nutrients coming from the blood. And therefore oxygen delivery, carbon dioxide removal, glucose delivery, things like this is going to be impaired because it's got a greater distance to diffuse across because of the increased fluid. I think that is the reason that edema leads to this disease of the skin, stasis dermatitis, but don't quote me on that. My understanding of the pathophysiology is not that deep. And the pathophysiology is not the main basis for this video. The main point of this video is to stress the difference between stasis dermatitis and bilateral leg cellulitis. So, there we go then. That is what stasis dermatitis is. It is a type of eczema that occurs over areas that are affected by edema. And it isn't just the case that it will only occur in the legs. It can occur anywhere that there is edema. However, the main place that people get edema is the legs, and therefore stasis dermatitis is most common in the legs. But if someone has lymphedema in an arm, for instance, let's say they've had breast cancer, they've had the breast cancer removed, and then they've had axillary dissection, so they've had all of the axillary lymph nodes cleared as part of the trying to rid them of cancer surgical procedure, that can then lead to massive problems with lymphatic drainage from the upper limb on the side that the operation was performed. So let's say they had left breast cancer, they had left axillary clearance, and therefore they're going to end up with lymphedema of the left arm. So they might end up with a very swollen left arm after that operation. They can then develop stasis dermatitis on top of that edema. However, pedoedema is far more common than upper limb edema, and therefore stasis dermatitis is most commonly seen in the lower limbs. Now, on to then the main... Oh, actually, just a little bit further, just some more things to add. Not only can you get stasis dermatitis on top of pedoedema, you can get other types of skin changes as well. You can get hemosiderin deposition in the affected portions of skin. So I'll just write this here. In fact, I might actually type it because it will look neater if I do. So hemosiderin deposition is another type of skin change that you can get in areas of pedoedema. Now, hemosiderin is a complex, a protein complex that binds iron and stores iron. And in areas where you have edema, you can get this hemosiderin, this complex of iron, and I do believe it's a complex made up from multiple ferritin molecules. So ferritin is a complex that stores iron within the body, and loads of cells use ferritin to store iron. And if you bind lots of ferritin complexes together, I think you end up with a hemosiderin complex. Now, for reasons again that I will not pretend to understand, in areas where you have pedoedema, bad pedoedema, you end up with this hemosiderin being deposited in the dermis of the skin that overlies that area. And this gives the area a brown appearance. So hemosiderin has a brown colour, so let me just try and get a brown, and I don't know if I'm going to be able to. Orange is the closest I can get. So let's get a thicker pen. In fact, I'll just so if we just put some dots here, this is kind of what it looks like, and I would urge you to Google these things so that you can actually see what they really look like. But you get a sort of brown discoloration along with the eczema, which is the stasis dermatitis. You might see this sort of brown discoloration on the legs, and that is hemosiderin deposition, and that's another skin change that you see in chronic pedoedema. And the other big one that I'd like to talk about is lipodermatosclerosis. Sclerosis. So again, I do not have a particularly deep understanding of the pathophysiology of lipodermatosclerosis, but the appearance of it, I know how to recognize it when someone has it. It's a sort of shiny appearance in its early stages. In its really, really advanced stages, it causes sort of tensioning of the skin that actually deforms the shape of the legs and gives you what's known as inverted champagne bottle legs. However, it's really rare for it to ever get to that sort of stage. So in the early stages, and if you look at the name of this, lipo refers to the subcutaneous fat, derma refers to the skin, sclerosis refers to hardening. So it's sort of this change is a sort of tautening of the skin, and it makes it sort of shiny in the early stages. So you might see actually this sort of shiny appearance. So I can't really draw that, but imagine this has a sort of shiny, glossy appearance. Rather than being matte, which is the normal appearance of human skin, the skin turns a sort of shiny colour, and that is what is called lipodermatosclerosis. And I believe that it's resulting from the laying down of new connective tissue in the lipo and dermato layers that gives it that shiny appearance. Some sort of shiny connective tissue is being laid down. Again, don't quote me on that. My understanding of the pathophysiology is not that in-depth. The real aim of this video isn't pathophysiology, it's clinical recognition. So the shiny appearance that you might see along with the hemosiderin deposition and the eczema is called lipodermatosclerosis. And as I said, if this goes into a really, really advanced stages at horrendous lipodermatosclerosis, the skin becomes so taut that it actually sort of starts to narrow the legs. So you end up with it sort of doing this, and you end up with a really bizarre appearance of the legs where they sort of are thick at the top and then they become really thin, ironically, at the bottom. So they were really thick initially because of the pedal edema, but if this gets advanced enough, they become really thin at the bottoms, and because that kind of looks like an inverted champagne bottle, that is known as inverted champagne bottle legs. But as I say, that's really advanced lipodermatosclerosis, and it's not that common. Inverted champagne bottle legs. It's far more common to see early stage lipodermatosclerosis, which is just the shiny appearance of the legs. So common things that you will see then in people with really bad pedal edema: they'll have stasis dermatitis, they'll have hemosiderin deposition, they'll have lipodermatosclerosis. They might also have ulcers. So as it gets more and more severe, the skin can start to ulcerate, and you can end up with little holes in the skin that might perforate down into the subcutaneous fat, or even deeper potentially. So I should actually draw this in red because it's going to be very sore. And that's the stage that this sort of skin disease gets really quite serious, because ulcers are a very easy access point for infections that can go into the subcutaneous fat and indeed can set up cellulitis, or indeed they could go into potentially the bone if the ulcer is deep enough. So ulcers are not good. And these ulcers would be classified as venous ulcers, again for the same reason that stasis dermatitis is sometimes called venous dermatitis. It's because chronic venous insufficiency is one of the things that can lead to all of this, and therefore these ulcers have been named after that. However, be aware that these ulcers can occur in pedal edema from all of these other causes as well. It's not just chronic venous insufficiency. So here are other chronic skin changes that can accompany stasis dermatitis. Now, one final thing that I would like to say: in people with really severe stasis dermatitis, the skin can start to become extremely thick and can become sort of like cracked. And this is what's called hyperkeratotic stasis dermatitis. So hyperkeratotic refers to too thick keratin layer. Hyper means too much, keratotic refers to the keratin layer. That's referring to the epidermis, because that's the layer of the skin that has the keratin there. So hyperkeratotic is where the skin becomes really, really thick. So you will sometimes see this. The cases that I've seen it in is people with absolutely phenomenally severe morbid obesity. They've got really swollen legs, and then they've got really thickened skin, and they have this hyperkeratotic stasis dermatitis, and it literally starts to look like scales. So the skin becomes so thick that it cracks, and you end up with like scales like this, red scales. So you have the cracks in between the scales here, and everything's red. Again, Google a picture of it, but it's part of this stasis dermatitis. Right, so there we go. Now back to the main message of the video, which is the difference between stasis dermatitis and cellulitis. So, back to my story. The patient that I saw had a degree of heart failure, had chronic pedal edema, and Stasis Dermatitis on top of the pedo edema. I don't believe he had any of the other chronic skin changes. He just had Stasis Dermatitis, and it was really, really red and angry looking. I put on a pair of gloves, felt it with the back of my hand, and it felt extremely hot to the touch, and that is how I ended up diagnosing this as cellulitis. So just to contrast Stasis Dermatitis to cellulitis. So cellulitis is an infection, whereas Stasis Dermatitis, as we've discussed, is a response to the pedo edema. It's not an infection. Cellulitis is an infection of the subcutaneous fat layer of the skin. So just to remind you of the structure of the skin, so you have the epidermis here, like so, the most outer layer of the skin. Then underneath that you have the dermis, and then underneath that you have the subcutaneous fat tissue here. Cellulitis is an infection of the subcutaneous fat tissue, and usually it is an infection that is caused by the bacterium Staphylococcus. So Staphylococcus is the usual culprit for infection in cellulitis, although sometimes it can be Streptococcus. Staphylococcus aureus, though, usually is the main bug that causes cellulitis. Now, cellulitis, the lesson that the consultant taught me after I diagnosed this, cellulitis is usually a single leg. It is very, very rarely. In principle, you could have cellulitis of both legs. If tomorrow I woke up and I had spreading redness up both of my legs, then yes, that would potentially be bilateral cellulitis. In principle, it can happen. In reality, though, in the real world, it doesn't happen. Cellulitis is nearly always unilateral, and therefore if you see someone with bilaterally red legs and the redness is symmetrical, and Stasis Dermatitis nearly always is symmetrical, as I've drawn here, it will nearly always be the mirror image on the other leg or near about the mirror image, then it is not going to be cellulitis, it is going to be Stasis Dermatitis. Now, pedo edema, however, is a big risk factor for developing cellulitis. It puts you at big risk of developing cellulitis. So what you need to look at very carefully is if you've got someone with pedo edema and chronic Stasis Dermatitis, you need to look at whether it is symmetrical, because if one leg is actually much redder than the other and the redness extends to a much higher level, so let's say this leg here, the right leg, is much redder now than the left leg, and the redness comes right up here, whereas on the left leg it only goes up to here, then even though they've got the chronic Stasis Dermatitis, it looks as though they've got cellulitis in the right leg here on top of the chronic changes. So be aware of that it is possible for someone who has chronic Stasis Dermatitis to get cellulitis. Indeed, it's very probable because of, well, they're at risk of it because of the pedo edema. However, in that case, what you will see is an asymmetry. You'll see one leg, the redness is going much, much further than in the other leg, and that's the situation where it is valid to say, okay, this person has right leg cellulitis, but they don't have bilateral cellulitis. On this side, it's just the Stasis Dermatitis. So again, I want to drill in this lesson, there is no such thing really in the real world as bilateral lower limb cellulitis. It is going to nearly always be Stasis Dermatitis. So, I think that might be all I want to say for this video. I might just end with a summary then, and this might point out to me if there is anything I have missed that I wanted to say. So, Stasis Dermatitis then, it is a chronic skin change, a chronic skin condition that occurs over areas affected by edema. Now, the most common area that people become edematous is the legs, so nearly always Stasis Dermatitis is found on the legs. It will be near enough symmetrical, it can be very red, it can look very angry, and it can be hot to the touch. One thing that I should also point out, a clinical trick here. Stasis Dermatitis, cellulitis, if you touch it, is boiling. Stasis Dermatitis is usually not going to be as phenomenally hot to the touch as cellulitis. So cellulitis, usually you can feel it and you know that something is ghastly wrong. In the patient that I described in my story, I said that I felt his legs and they were very, very hot, and indeed they were, but the thing that I should have done, which the consultant pointed out to me afterwards, is that if you feel the areas around where it is red, in his case, his healthy skin was just as hot as the actual area that was affected by the stasis dermatitis. So it was just that he had very hot legs, and I was feeling the area that was affected by the stasis dermatitis thinking, oh, this is very hot to the touch. But it is very important when you're feeling a red area of skin to assess temperature that you also feel the surrounding normal areas of skin and you compare, is there an actual temperature difference? Because if there isn't a temperature difference, and if it's just that he has a really hot leg, and all of the leg is hot, whether it's healthy or not, then that isn't a positive sign. Whereas if you feel the surrounding skin and it's cool, and then you go to the area of redness and it's really boiling hot, then that is more of a clue towards it being cellulitis. And just another little thing to throw in there. So stasis dermatitis then is a chronic skin change that occurs over areas of piloedema. It occurs often with these other skin changes. So you might see hemosiderin deposition, you might see mild lipodermatosclerosis. In more severe stages, you might see ulcers and potentially even this inverted champagne bottle legs, that is severe lipodermatosclerosis. And finally, the big lesson then of the video is that if you see someone with bilaterally red legs, the redness is symmetrical. If you ask them, they will probably say they've had it for years. That is not bilateral lower limb cellulitis, it is stasis dermatitis. Bilateral lower limb cellulitis is phenomenally rare. In principle, it exists. In the real world, it never exists, pretty much. So do not make the same mistake I made. Do not make this as a diagnosis. Cellulitis, it should be one leg is red, hot. But be aware of the fact that people with this chronic skin disease, with piloedema, are at risk of getting cellulitis. So always be on the lookout for whether the redness extends far further on one leg than it does on the other leg, because that may mean they've got cellulitis in that leg, but they won't have cellulitis in the other leg. Again, there is no such thing as bilateral cellulitis. Thank you very much for watching this video.